Today, we're going to talk about radiology, um, kind of the basics of it, how it works, what we do for protection, so that we don't get exposed to radiation, and then creating a diagnostic X-ray. How do you tell if this is diagnostic? Is it good? Is it bad? Do we need to retake this image so that the vet can make their diagnosis? All right, so just a couple basics here. This is the tube of the radiography machine. Remember when you're talking to owners, realistically, we're taking radiographs. It is using X-rays to create that image, but we are taking radiographs. We often use the wrong words when we're talking about that. But this is the part of the machine that generates the electrons. This generates the X-ray itself. We have this spot here called the cathode. That is what heats up and generates the electrons, shoots it across this tube to our anode. It's this piece here, and shoots them down towards the patient. This machine, when we're not actively using it, there's nothing dangerous about an X-ray machine. All right. You may hear the term heel effect sometime. And basically, what this is talking about is the X-ray beams are more intense at the cathode side of the machine. Now, you won't hear that probably in the clinics, the term heel effect. But what we do is we always put the head end, the thickest part of the patient, on one end of the X-ray table, and that's just consistency to take into account that heel effect. All right, just real quick about some X-rays and how they look underneath the microscope here, or sorry, on the X-ray machine. Air. Air turns black. It's going to be the darkest area. This here is some gas in the intestines. Fat tends to be some gray, a little bit more gray. You see this in this area right in here, around the edge here. That's going to be fat. Soft tissue, just a little bit brighter up in here. Bones, you can easily tell where the bones are, this light white area. And then number 5 here, this is actually a wedding ring. Metal or our contrast material are going to show up as bright white. Right. So when we talk about density, this is the overall blackness of the film. Can we see what we need to when we're taking a look at, or when the vet is looking at this? If the image is too dark or too light, we're going to mess around with what's called the KVP. KVP controls the controls the quality of the electrons when they're coming out. So how forceful are they coming out? How easily can it penetrate this animal? So if the image is too light, those electrons aren't coming out fast enough, and it can't penetrate through the body to get to the film underneath it or the cassette underneath it. If they're too dark, on the other hand, that KVP is turned up too high, and they're all going through, and they're all getting to that film, and we're going to have a black film. We can't see what we need to. You're going to hear the term MA, or milliamperes. Milliamps are the quantity, the number of electrons that are being produced. So when we look at this chart over here, every measurement we have here, we can adjust the KVP and sometimes the MA in order to get the most diagnostic film. KVP changes every time, but realistically, your MA, look at the abdomen here, that stays at 15 the entire way through. So with a spine, it stays 40 the entire way through. So we don't typically change your MA to affect the image. It's usually the KVP. What I do want you to look at over here is the thickness. So we have a caliper. It is a metal contraption that one end slides underneath the patient. The other one comes, we lay across the highest end of the patient, and it measures in centimeters how thick that patient is. And we use that measure to decide what KVP we need. Always, always measure. We don't want to look at the patient. We don't want to guess. We want an accurate measure for that. All right, so back to this image quality. These two images here are both poor. The one here, this is too light. Not enough of that of those electrons of that radiation is getting through to the animal. Focus on increasing KVP here. So nowadays, almost all of our radiology is digital. So there's a cassette there. It automatically takes it to the computer, or we set it in a machine. It reads it, and within a minute, it gets it to the computer. Old style of radiography, we used to use films to do all this, and those X-ray films had a bunch of chemicals that were kind of went along with them. We had to put them in different chemicals in a different order for different times. But that's where the increased developing time and temperature comes into play. And you're probably not going to do that too much, so I'm not going to focus on that. And also with the film distance, this is more with portable X-ray, or if we're doing it with farm animals. Almost all of our systems in the clinics now are fixed tables. So our tube is automatically a set distance away from the cassette. Excuse me. So depending on what we're doing, might want to do a couple contrast studies within a patient. So this one here actually has an ostomy. You can see this tube going in here. This is, they're going to do a barium contrast with this. So they are taking the barium and putting it directly in. Barium is what's called a positive contrast. So you can show it up as bright white here. We often do these as a swallow. So the animal ingests it, and we can, depending on what we're looking at, where we're looking, every 15 minutes, and then down the road, it's usually about once every half hour. We're going to take a X-ray to see how this is progressing down through the system. No matter what, when you're doing contrasting, the big thing here is always do what they call a survey film or a scout film. So a scout film is, they have nothing in them. There is no contrast, there's no barium. This is what we compare everything to. This is the animal as it is today, right now, and this is what we want to compare. We also have what's called a negative contrast, and this shows up as black on the X-rays. A lot of times they use this with in the bladder. You can say they put some air or carbon dioxide in there, and it shows up as black. Once in a while, they'll do a double contrast, which uses the positive, which you can see here as the bright white, and then also a negative, which is the black around the edge of it. All right, big thing I want to take you guys to take away from this is thoracic X-rays. Anytime we do thoracic radiographs of the animal, we always want full inspiration. So we want it when that chest is expanded, taking the biggest breath that animal is going to take, and we want to get it in that during that view. Always do at least 2 views. So we want them laying on their right side down or right lateral, or left side down, left lateral, and then either laying on their back, which would be called ventral dorsal or VD, or laying on their stomach, which would be DV, dorsal ventral. So always labeled as the X-ray beam enters the animal and where it leaves it from. Anytime you have an animal in respiratory distress, we want to limit their stress as much as possible, limit their handling as much as possible. So hold off on rolling these guys up on your back, on their back. Try to keep them in dorsal recumbency and comfortable if we can. Probably we're also going to have the oxygen machine nearby, just in case we get into some issues. All right, so here, this is a thoracic X-ray. Obviously, these aren't the same quality. The one with the R marker here, the right side, is on full inspiration. It's probably a little bit light to be able to diagnose things. The one on the right here is actually a little bit better of a picture. but they're on expiration. See how this triangle of lung here is a lot smaller on this side. So it's harder to see things, harder for the vet to diagnose if we don't have that full inspiration. So a little bit of what we talked about. Um, how is this? What do you think on this one? Right. One thing, this animal's in right lateral recumbency. We have the R here, but this is an is too light. This is not a diagnostic film. We can't see what we need, or the vet can't see what they need, or contrast between organs here. All right. How about this one? Really, this one's good. You can see black, you can see white, you can see fat in here, gas going through the intestines. This is feces in the colon down here. This is a good diagnostic X-ray or radiograph, sorry. This one, other than being taken on exhalation, so they were breathing out, this is a good film. We can see the trachea going down into the lungs. We can see the heart well. You can see some of the bronchi going through the lungs. We can see the ribs. Has good contrast. Other than exhalation, that's a good image. All right, this one is way too dark. So we can see the spine and ribs well, but everything else can't really see a whole lot of detail there. That image is going to be too dark. So a cool thing about this one here is if you look right at the tip of that blue arrow, there's some little white, mm, lighter spots, but they're almost little tiny circles. That dog has bladder stones. Um, that's not what we were looking for, but sometimes they do show up here. So this one is constipated. You see these big fecal balls here. But as far as quality, this is good. You can see contrast. We can see loops of bowels. You can see the spine, the vertebrae. That's a good X-ray. This one, so other than the marker, realistically, the marker should always go on the cranial or towards the front of the image. So the R marker here should be up top. But other than that, this is a good diagnostic image. All right, and again, this one's a good one. You can also see this cat is microchipped. You see that little white spot over in the armpit there? All right, so here, a couple things going on with this one. One, it's not the best contrast, but two, the X-ray gloves in the screen there. So it is blocking off some of what we're looking for. Your PPE that you wear, the thyroid shield, the lead goggles, the lead apron, and the gloves don't protect you from primary radiation. So with this one here, having the hand directly underneath the beam, that person is not protected from radiation. The other thing to note here is the collar. So since the collar's still on there, those X-ray beams can come through, hit the metal, and bounce off and cause scatter radiation and expose us. All right, so this one here, if you're looking at the spine or the head, this isn't bad. This is a pretty good diagnostic image. But the big thing I wanted you to see here is we can't do good dental X-rays using our general radiography machine. We really can't see what's going on with all these roots. Some of these teeth are hard to tell where they belong. So that we're going to use a dental machine for. All of these are good pictures. You can see the top of the tooth, you can see the roots, you can see the bone surrounding the tooth or the alveolar bone. You can see the pulp of the tooth going up through here. That's where the blood vessels and nerves come into the tooth. These are all good diagnostic images. These three are probably pretty good. This one here, you can see these two roots, but once you get out towards the outer side, it's hard to see very much definition with these. So this one probably should be retaken. All right. Now, the reason dental x-rays should be done. It is recommended to do dental x-rays on every dog that comes in for a dental procedure or dental prophylaxis or tooth cleaning. Reason for that is with this quarter here, this is the canine tooth. This is the big tooth up front. This one here that everybody sees, the big fang that hangs out. Half to 2/3 of that tooth is underneath the gum line. Realistically, most teeth, at least half of them are under the gum line. So you can't see what's going on with them necessarily just by looking above. So this mouth here, these two pictures go together. This is our canine tooth here, which would be here. This is a premolar here and a premolar here, which are these two teeth. And looking at the gum line, it looks like they're missing that tooth. But when you actually get into it and do that dental x-ray, you can see that tooth was broken off and we still have remnants of that tooth underneath the gum line. All right, so here, this one looks like it's good from above. This is a premolar as well. But when we do that x-ray again, the root is busted off or broken off on that one side, this part right here. This one here, this tooth looks good. It's healthy. It is in there snug. There's no mobility to it. But when they do the x-ray, this darker spot right here is a pocket of infection or an abscess. This one here, the lighter spot of that circle is infection, but it actually caused that bone to deteriorate around it. So this black spot is there's no bone there, right? See how that tip comes down almost to the bottom of the jawline, and then we have this space without any bone. That jaw is very fragile and can fracture very easily. And then this one here, this cats in particular can get a thing, they call them neck lesions or feline oral resorptive lesions. And for some reason, their body starts breaking down their teeth and taking the components out of it and reabsorbing them. All right, so this tooth here, that's actually happening to that. So if you look at this compared to this tooth, this is solid and pretty uniform in color. This is pretty mottled, and that's from that tooth being broken down. So, all right, reach out to your instructor if you have any questions on looking at x-rays. We can't make diagnoses, but we can look at it and determine if this is a diagnostic image where the vet can see what they need to, or if we need to retake it.